This is Wendy Dedez at Dedez Physical Therapy. We're today demonstrating the lumbosacral stability taping using rock tape. So rock tape is used for a multitude of things, but we often will use it to stabilize areas of pain and dysfunction. So when you're taping at home, if you don't have good adhesive hold, you can always use a spray. I am not going to use that today, and I often don't need to on the back, but if the tape comes off within 24 or 48 hours, then you may want to try a spray. So the taping for the lumbosacral area is going to span from the lower thoracic spine all the way down to the sacrum. I'm going to just put a little dot at the SI joint area, which is the PSIS region. It's kind of the dimple area in the low back where the lumbar spine meets the sacrum. So we have two of those joints, one on either side, and in Allison they are right there. So that gives me a guideline. So when I take the tape, I am going to start around the lower mid-back, and usually that's around T10, and then I'm going to bring the tape down to those PSISs or SI joint region, knowing that it's going to stretch further. So this is how long that first strip will be. And then often I'll use that same strip and just notice, does it cross the pelvis and the sacral area nicely? And this actually does. So if it was too short, then I would get one that does cross and cover both of the SI joints. And so that will be our second strip. And then we'll have two more strips, and these two will be actually approximately the same. I could see, yeah, these will be approximately the same. I'm going to make the last two strips about 1/2 inch longer than this one. And then once I have all the strips, I round the corners, which helps maintain the strip on the body so it doesn't catch an edge and get peeled off prematurely. We like to have this stay on for approximately a week, and during that week you can shower and do everything you normally do, and you will have extra stability in your lumbosacral region. It does help activate the musculature for stability, so you will actually get stronger. This is not something that will make you weaker over time. The more you use it, usually the quicker you will become stable and the quicker you will become stronger in this region. If you have skin allergies to the tape, then you are unable to use it unless you can find a barrier. Sometimes we use Pepto-Bismol to put on the skin, let it dry. Once it's dry, it creates a thin barrier from the adhesive to the skin, and people that are allergic or sensitive do better with that or with a spray. So to start, I'm going to do a vertical strip starting up in the low thoracic spine with about 1/2 inch with no stretch. So I just peeled the backing off and placed 1/2 inch on the spine. Then I'm right in the center, and I'm going to pull this strip down while I'm peeling the backing off, which gives it about a 20 to 25% stretch. And then the last piece, there's no stretch. So then we just brush that on, create a little heat and friction to have the adhesive hold. So number one is done. Okay, the second strip is across the SI joint, the L5, L4 area. I take the entire backing off. I hold the strip with my thumbs and index fingers And then I come to this area, pull a full stretch, come off about 70% and put that right there. Then the 1/2 inch on either side, I just lay down without a stretch. And the same thing, create a little friction, get the adhesive to hold well. Then we're on to strip number 3. And these two are going to start in the thoracic area, the lower rib cage, cross over and end in the gluteal area to help activate the glutes. So it's helpful to have a little bit of skin adhering when we get into this area on each strip of tape, and it will hold better. So I come down, come across, around to L3 to L4, then down into the glute, and lay the ends without any stretch. The last strip is a mirror of the number 3. No stretch again. And then coming down and across around L3, L4. And then down into the glute, no stretch. And again, some friction. And so we have a lot of stability created from about L2, L3, all the way down past the SI joints. So this is the taping. We'll just pause for a moment and show you a picture from above.